Welcome to all of you to our JUICE session today, which stands for Just Using Intellectual and Creative Energy. I'm Christina Rose, and I'm the Acting Director for the National Institute of Justice, a component of the Office of Justice Programs in the U.S. Department of Justice. And today we have with us Dr. Rebecca Campbell, and Dr. Campbell is a professor of psychology at Michigan State University. And Dr. Campbell has made important contributions to the research in the area of how legal, medical, and mental health systems respond to the needs of rape survivors. Her current research, which she'll be discussing today, examines the effectiveness of sexual assault nurse examiner programs in the prosecution of adult sexual assault. She is the author of Emotionally Involved: The Impact of Researching Rape, which won the 2002 Distinguished Publication Award from the National Association for Women in Psychology. Dr. Campbell also received the 2008 Distinguished Contributions to the Psychology in the Public Interest Award from the American Psychological Association. Her PhD is from Michigan State University, and we are very grateful to have her with us today. Becky?
Thank you very much, Chris. Good afternoon, everyone. Thanks for coming. It's a pleasure to be here today and to have the opportunity to talk with all of you about my research on the impact of sexual assault nurse examiner programs on the investigation and prosecution of sexual assault cases. What I'm going to be talking about today is a project that I recently completed that had two primary goals. The first was to conduct a series of research studies where the goal was to try to figure out whether sexual assault nurse examiner programs, or SANE programs, can have a positive impact on adult sexual assault prosecution. So we wanted to find out if whether prosecution rates would increase from before to after the implementation of a SANE program. And then if so, why? Why is there that change? What is it about a SANE program that helps contribute to increased prosecution rates? And then building on those findings, the second goal in our project was to develop an evaluation toolkit for practitioners. The idea was to take science into practice by developing a step-by-step tool guide so practitioners could also study whether they are having a positive impact on their criminal justice systems, and if not, what could they be doing to try to increase prosecution rates. Now, I had a wonderful team at Michigan State that helped me do this project, so I want to take a moment to acknowledge my co-investigators and all of my project staff. And what I'm going to be doing in my presentation today is I'm going to start off with a very brief background of information about sexual assault nurse examiner programs and adult sexual assault prosecution. And then I'm going to give you an overview of the multi-study research project. I'm going to highlight our key methods and the key findings from this study. And then I'm going to wrap up by describing that practitioner toolkit and discuss its utility to practitioners. So first off, by way of background, what we know about adult sexual assault prosecution is that national data indicate about 17% of all reported sexual assaults are going to be successfully prosecuted. Now, this rate is in the ballpark of other felonies, but it's low even among felonies. And this has been a long-standing frustration for survivors, for community practitioners, including law enforcement and prosecutors, as well as for rape victim advocates. So in response to this problem, communities throughout the United States have been developing multidisciplinary response programs to try to improve reporting rates as well as prosecution rates. And one of these programs that's received the most attention nationally has been sexual assault nurse examiner programs, or SANE programs. Now, SANE programs were created by the nursing profession, and they were created to provide comprehensive medical care to rape survivors. So they provide a complete examination of the survivor and treat any injuries that might have come from the assault. They also attend to victims' emotional needs, so they focus on the crisis of surviving sexual assault and making sure that the victim's emotional well-being is attended to. They also do an excellent job with collecting forensic evidence, documenting the sexual assault crime, as well as any injuries that the victim might have sustained in the assault. Most SANE programs also provide training and consultation to law enforcement and prosecutors in their communities so that police and prosecutors know what to do with this forensic evidence and the injury documentation that the nurses have collected, and show them how it can be used to help build a successful case. And should the case go to trial, the nurses can provide expert witness testimony so that they can explain to judges and juries the nature of the forensic evidence and the injuries. So in light of the different kinds of resources that SANEs provide, both survivors as well as the legal community, it really does raise the question of whether SANE programs could be making a dent on this problem of under-prosecution of sexual assault. And what we know from prior research on SANE programs is that there's been several case studies that have suggested that SANE programs do increase prosecution rates once they've been implemented in a community. Now, many of these are case study research, so they don't have appropriate methodological controls to be able to determine whether the effect was really attributed to the SANE program. For that, you would need a quasi-experimental design. And at the time we began our project, there was only one quasi-experimental design that had ever been done. It was a research study funded by NIJ, conducted by Crandall and Hellitzer in New Mexico. And what they did was they compared prosecution rates 2 years before to 3 years after the implementation of a SANE program in a New Mexico community. And what they found was very striking. They found statistically significant increases in the number of forensic exams, or kits as they're sometimes called, being collected. The arrest rates went up, the number of charges went up, convictions went up, sentences went up. Everything went up. It was a complete out-of-the-ballpark home run. So what we wanted to do in our research was try to build on this work and examine whether there would be a positive impact of SANE programs in a different state, different context, different community. And we also wanted to use an even stronger quasi-experimental design than what this prior study had done. We wanted to look at a much longer time span. So we looked at 5 years before to 7 years after the implementation of a SANE program. And we really wanted to focus on the comparability of the before and after cases, because that's very critical in a quasi-experimental design. And I'm going to come back to that point in a few minutes, because it really is quite essential. And then building on prior work, we wanted to look at this issue of why there may be change. It'd be very nice to see that SANE programs increase prosecution rates, but why is that? Is it as simple as if you introduce a SANE program, prosecution rates go up? Not likely. So what is it about the program, about the community context? What are the critical ingredients that really need to be in place for a SANE program to have the opportunity to make a positive impact on the criminal justice system?